It is now my pleasure to introduce Ms. Kathy Rydell, the Academy's Executive Director and CEO. Kathy has directed the Academy for over 12 years and has been an extraordinarily effective leader. She has brought us successfully through the recent economic downturn without a deficit, without laying off staff, and with, in fact, continued expansion of Academy services to you, our members. One of the pleasures of being president is working closely with AAN staff, all 140 of them, and my daily contacts with Kathy. Kathy served as executive director for the North Dakota Medical Society before coming to the Academy, and she knows how to get things done in the political arena. Important for all neurologists is the fact that she's been highly visible on the national stage with medical associations, giving us a much louder voice than our position of having roughly 1% of practicing physicians, as neurologists would ordinarily command. I'm pleased to introduce her to you today to make some remarks. Ms. Kathy Rydell.
Good morning and aloha. Recent national disasters remind us how swiftly and how suddenly change can come, and how we must be vigilant and prepared. While the changes you are realizing in neurology are by no means as catastrophic or as devastating as an earthquake or a tsunami, they can send shockwaves through the profession. Today's neurologists face confusion over healthcare reform, the loss of reimbursement, the demands of recertification, threats to research funds, pressures to adopt new technologies, and the encroachment of other specialties. And we know these challenges can be magnified in countries where there are few neurologists with limited tools and resources, and where they must treat an entire nation. But if we need inspiration to overcome these hurdles, we can find them among our members. In Dr. Singh, one of our Palatucci Forum advocacy leaders, who hosts a series of epilepsy camps around New Delhi and provides care on the Lifeline Express, a hospital train that provides medical treatment to the rural poor all across the countryside of India. We take pride in two of our recent VISTI Patient Advocates of the Year, Dr. Mahari, who regularly travels from his home in Kentucky to provide care and education programs to AIDS orphans in his native Ethiopia, and Dr. Potts, who started advocating for arts programs for Alzheimer's patients after seeing his ailing father blossom as a first-time artist, even though his dementia was increasing. We value our AAN neurologists in the armed forces, particularly such doctors as Colonel Scott, who served in Afghanistan, and Colonel Ling, who served in Iraq. They face dangers on the front lines while treating scores of wounded soldiers, many with traumatic brain injuries. In 2007, I'm pleased to say that the Academy successfully fought for better patient treatment for these patients with TBI through passage of the Dignified Treatment of Wounded Warriors Act. These neurologists are but a few of the 23,845 members who are the heart and soul of this academy, from the medical student to the senior retiree. Several thousand of these members, researchers, practitioners, teachers, and administrators are here today. We have nearly 10,000 neurology professionals, exhibitors, and media at this annual meeting, representing 90 countries from across the globe. And I invite those of you who are not members of the Academy to consider joining. I can guarantee you will be welcomed both by your colleagues and by the Academy staff. Seated among you today are many of the 533 members of the Academy who collectively volunteer more than 210,000 hours of their time to serve you. They serve as members of the boards of directors, committees, subcommittees, guideline work groups, presidential task forces, sections, and editorial boards. The Academy has a professional staff of 140 men and women in St. Paul, Minnesota, Washington, D.C., and Rochester, New York, who annually work more than 300,000 hours to serve you. Just to prepare for and administer this meeting takes as many as 37,000 hours. Together, our leaders, our volunteers, and our staff are united in achieving the vision of the American Academy of Neurology, which is to make this organization indispensable to our members. To be indispensable, the Academy recognizes that it needs to be at your side throughout your professional life, from student to retiree. And as your needs change, the Academy must anticipate them. Through our surveys and our assessments of member needs, as well as one-on-one conversations and focus groups, you tell us how the Academy can help you cope with the challenges and the changes in your profession. We listen, we analyze, and we explore viable solutions and determine the best possible solution to meet your needs. Much of the work of this organization, both from its members, its volunteers, and its staff, is devoted to developing the programs, tools, and solutions for you, both today and tomorrow. As part of our mission to promote the highest quality, patient-centered neurologic care and enhance member career satisfaction, we provide you with learning across your lifetime. The public demands greater accountability from physicians, and certifying bodies demand greater demonstration of your knowledge. So your peers in the Academy have developed the tools and resources to help you cope, to help you prepare. These tools can be used by any neurologist from any country, anyone who wants to improve their skills. And as you know, neurologic disorders do not respect national borders. No matter where you live, the Academy has much to offer. Our evidence-based practice guidelines have universal applicability, whether in Miami, Seattle, Mumbai, or Santiago. The AAN reaches out to our international friends in many ways, and we especially focus on our neurologist members from underserved and low-income countries. We do that through reduced membership dues and scholarships to this annual meeting. And in addition to our 300 US-trained advocates, we have nearly 24 international members who we have trained to be effective advocates for their patients and their profession through the Palatucci Advocacy Leadership Forum. In the United States, advocacy efforts have grown considerably, thanks in great part to our Political Action Committee, the Brain Pack. This helps us with our interactions with members of Congress. These are the people that are making decisions every day on how health care will be delivered in this country. The Academy succeeded in helping prevent last year's Medicare cuts, and we are meeting with key legislators constantly on Capitol Hill to work toward a solution. We have recently worked with senators on both sides of the aisle to introduce Senate Bill 597. This will provide neurologists with the same incentive bonus that primary care physicians are scheduled to receive. And we are not giving up the fight for the restoration of consult codes. And we will also continue to work for medical liability reform and, of course, increased funding for research. In addition to our hundreds of advocacy volunteers, we have also increased our advocacy staff by 40%. We know things are tough out there, but the Academy cannot do this work alone. We need our U.S. neurologists to be aware of the issues, to respond to our action alert emails, and to contact your legislators. And we encourage our international members to continue to stand up for neurology and their patients in their countries. If we are not together on the front lines advocating for neurology, we are all at risk. Along with thanking our tremendous staff and our tremendous member volunteers for their tireless work on your behalf, I want to acknowledge the significant contributions of my executive team. This group would be the envy of any organization. They deserve an enormous amount of credit and gratitude from both me and our members. We are also indebted to the amazing leadership of AAN President Birch Griggs, AAN Foundation Chair Austin Sumner, and AEI Enterprises Chair Steve Ringel. They are all completing their terms immediately following this annual meeting. I have worked elbow to elbow and heart to heart with these fine men, and I cannot thank them enough for their wisdom, their inspiration, and their vision. Yes, our leadership does change, but our vision and our mission do not. The roots for everything the Academy does can be traced back to the Academy established by Dr. A.B. Baker in 1948. But this is not A.B. Baker's Academy, and I think he'd be proud of that fact. It is your Academy, ever evolving to meet your needs in a world that is constantly changing, sometimes gradually, sometimes dramatically. So when you walk away from this meeting, please be assured that the American Academy of Neurology is here to meet your needs every day and every step of the way. Thank you.